Imagine this. You're sitting in yet another waiting room, flipping through outdated magazines, watching the clock tick by as you wait for another specialist appointment this month. Your calendar is a maze of follow ups, lab work, and medication refill reminders. The medical bills pile up as quickly as the paperwork. That's the reality for millions navigating life with a chronic disease. According to the CDC, an estimated 129 million people in the US are in the same boat, managing at least one major chronic condition. That's why today's conversation is so important. We're diving into navigating chronic disease with a particular focus on inflammatory bowel disease and breaking barriers to care. And we have the perfect guest to help us unpack this, Tina Aswani Omprakash. Tina is the CEO of South Asian IBD Alliance, known as SAIA, an award-winning women's health advocate based in New York City. After her own Crohn's disease diagnosis and life-saving ostomy surgery, Tina created Own Your Own Crohn's, which went viral by highlighting cultural determinants affecting GI care. Her work has been featured in the New York Times, Time Magazine, and prestigious medical journals. Tina, welcome to the show.
Thank you so much, Dr. Bio, for having me. It is an honor to be on your podcast.
It is a pleasure to have you on the show. And just for some context, I'll share with the viewers, Tina and I met at the South by Southwest conference. We had a fantastic conversation about health equity. So I am so excited to have her join us today. So Tina, what we're going to do is we're going to start with some rapid fire questions that I love to bring our listeners into your perspective when it comes to being a patient and a health advocate. Let's start just for some fun. Are you up for it?
Absolutely. I can't wait.
First, what was the most surprising reaction when you first started sharing your story publicly?
There was a friend of mine, not so much a friend of mine anymore, who said, "Oh, but I went to India and I ate something and got diarrhea for 3 weeks. I know exactly how you feel."
That is a lot to take in.
Yeah, a lot to take in.
Yes.
And I was like, I wish I could go to India and get diarrhea for 3 weeks and not the rest of my life. You and deal with everything else that comes with inflammatory bowel disease, because it's not just a bathroom illness or an illness that results in diarrhea.
It's interesting because when you look at dialogue or conversations, especially with having an autoimmune disease myself, when you have a conversation about your symptoms, what you're going through, I honor that people are trying to meet you where you are, but there's something to be said about leaning into how can I get to know this person's journey more? What are my biases that might be a part of what they're sharing with me? Because that can, and going back to your point, used to be a close friend. That allows you to have a deeper connection, a friendship with someone, especially when they're going through a health journey. And let me just highlight this. It's not just one and done. It's a health journey that is throughout all areas of our life.
Absolutely, 100% agree with you. And I think also what I was sharing is highlighting that this is not just a disease of food. It's not just something we ate that did this to us. This is an immune mediated inflammatory disorder, and it's nothing that we necessarily did to ourselves.
And that brings up that blame kind of, oh, do you think I did this to myself? We're going to keep going, but we're going to circle back to that. The next question I have is, do you think, and this is a perfect, do you think most people understand what Crohn's disease is?
I don't think so at all. So I used to work on Wall Street, and I remember one of my bosses bringing in a whoopee cushion and sitting on it and making farting noises. And I was just like, are you kidding me? People think that Crohn's disease, ulcerative colitis, all under the umbrella of inflammatory bowel disease, is a bathroom disease. And that's all it is. And that, you know what, you can take some medication like Imodium or something, or that you can change your diet or some Pepto Bismol and fix this. It's not that simple.
That's why I'm glad we're having this conversation today. You've traveled a lot and navigated the challenges that come with limited food options. What is your go to food order when you are at a restaurant?
Great question. Something that I always find suits me is mashed potatoes. So, no matter where I'm at, I'm vegetarian and something bland, especially when I'm not feeling well, but I still want to see my friends or my family and interact with folks, I will ask for mashed potatoes.
Love it. Next one. Is there one piece of health advice you give others that you sometimes struggle to follow yourself?
Don't be so hard on yourself. I think sometimes I'm just really hard on myself and it's hard not to be. And I often have to catch myself when I am being hard on myself or sort of internally saying to myself, Tina, you shouldn't have eaten that. You shouldn't have exhausted yourself so much. You should have slept more. Like there's only so much we can control in life. We can do the best that we can, and that's all that we can do.
And it circles back to your point. First, it's not something that we did to ourselves. And second, we're human. We have to live the best life that we possibly can. That includes grace to ourselves.
100.
But it's hard. I struggle with it as well.
It's very, very hard, but I think it's important to remember to build in that self-love every single day, even if it's writing affirmations on a post-it, putting it up on your bathroom mirror, whatever it takes. I always try to remember not to be so hard on myself.
I agree. In my household, I have shared with my little girls since they were little, we do affirmations every morning, even if I'm traveling. And the reason why is when you step out that door, wherever you are, there are people who are going to try to break you down. And so my hope is that they have this invisible armor of positivity that they've been saying since they were small. So when they do meet those people who are not serving them or well or intentional, they have something, internally, like you said, that self-care to know that they do matter.
Absolutely. And I love that you do that with your daughters. First of all, I'm so glad to hear that you have daughters and that they have a mother like you. I'm just going to put that out there. Building that into your routine every day, the affirmations is so, so important, not just for self love, but to build gratitude.
Yes, it's so important. Okay, next question. What is one trick you've learned about navigating the healthcare system that many people might not know?
I would say there's multiple tricks, but one major one is trying to learn how to navigate health insurance. Learning all the vocabulary around health insurance is actually kind of important and almost feels like you're getting another degree in college. So
I agree.
if you want to navigate the healthcare system really well, learn health insurance and learn what the coverage includes so that you don't get any surprise crazy bills that are like for thousands of dollars.
And you can catch those mistakes that are there and instead of
100%.
assuming that this is correct.
100%.
Fantastic answer. Did you ever imagine starting a blog about your ostomy journey would open the door to help so many people?
I never in my wildest dreams imagined that that would be the course of my life. I am generally, I know people don't believe this, but I am pretty introverted and keep to myself and honestly never really use social media until I started my blog and my social media advocacy platforms. And the main intention behind it was just, I want to help people. And I was like, you know what? I can use my voice for a good reason and help people feel less alone and less isolated. And that's why I did it. But never would I have imagined that I would do something like that in my life.
As so many people will be surprised, and it's that lived experience, that drive. It's powerful, it's authentic. I am grateful for the work that you do, although the journey was unexpected. You are helping so many people that you'll never meet, feel seen and feel heard. So I appreciate you playing along with me. Now let's get to the real conversation. First, I'd love to hear you describe what is inflammatory bowel disease and what are some symptoms people should be aware of.
IBD is Crohn's or ulcerative colitis, even unspecified colitis. It is different. I want to highlight this from irritable bowel syndrome, IBS. They're both conditions of their own right and both important conditions. I have both. Inflammatory bowel disease really can affect anywhere from your mouth to your anus. That's Crohn's disease. Ulcerative colitis can affect your colon, meaning your large intestine, and your rectum. And they are diseases that cause bleeding from the intestines, cause ulcerations, rectal pain, can cause diarrhea. They can cause a lot of abdominal pain, even upper GI symptoms if you have Crohn's disease, and they can lead to malnutrition and weight loss. It is really important if you have any of these symptoms to see your doctor immediately and get a referral to a gastroenterologist.
I've seen many patients who have been diagnosed in their 30s, their 40s, their 50s, and I think of all of the time that they have lost not knowing what was going on. And that time is life saving. Would you agree?
I completely agree. I think you're bringing up some very important points, Dr. Bio. There is a lot of time lost into finding the name for this diagnosis, oftentimes because many of us don't even feel comfortable going to the doctor. If imagine like you have rectal bleeding and you're seeing blood in the toilet and you're like, how do I talk to a doctor about this? This is so embarrassing. And that's literally what happens to a lot of us patients is by the time we get a diagnosis, it's already become a more complex version of the disease. And then if you don't mind me highlighting the other aspect of this, communities of color. I can't tell you how many times I hear from Black African American patients or Hispanic American patients, South Asian American patients saying, you know what? My doctor said to me that South Asians don't get this disease. I was told that by a South Asian provider. And so there's a lot of education that needs to happen on both sides, on the patient side, on the HCP side, healthcare provider side. We've come a long way, but there's definitely still a ways to go.
When we speak about health literacy and health education specifically, it's not only from the patient side, as you brought forward, but it's the clinician, it's the provider side. One thing that I have found very helpful to help bridge that gap is acknowledging the bias that I have, even as a clinician, when I see my patients and sharing that with my colleagues, because a patient can come in and share all of their symptoms, but if you have a bias that is a part of that diagnosis, you're going to miss it. You're going to miss that opportunity to do what you are hoping to do, which is serve your patient and help them. And, I just want to honor that experience that you had sharing, well, no, you wouldn't get that because of your ethnicity, your culture is another gap that has prevented us from having health equity when it comes to all diseases.
100% agree. And I will also just say there are different reasons for why communities of color like ours, why there's delays to uptake of therapy, whether that's bias coming from the clinician, from the physician side, or even if that's cultural stigma, like there is in my community.
This leads into you've shared openly about your journey. I would love for you to highlight some, I know there were many challenges that you faced leading up to your diagnosis.
It's really hard to talk about. Like, my father also passed away from this disease, and he had Crohn's that turned into colorectal cancer. So, with Crohn's or ulcerative colitis, after 8 to 10 years of having this disease, you can develop polyps and you're more at risk for colorectal cancer. So, it's important to get screened, usually once a year or every couple of years. And it's important to be on treatment that's effectively treating your disease. So, it's really hard for me to sometimes talk about what I went through in my childhood after my father passed away. There's a lot of trauma there, to be honest with you, but my family basically was launched into poverty after my father died. He was the breadwinner. My mom was 27 years old when he died. My dad was 39 and I was 8 years old. And my mom was an immigrant single mom who did not even know how to write a check. She was a housewife. She did the primary role of raising my sister and me, who also, by the way, has Crohn's. We didn't know how to navigate the health insurance system. We didn't even have health insurance because there was no ACA back then. I don't think people realize how far we have come with the Affordable Care Act and the marketplace and having access to different options of health insurance. So I did not get a diagnosis for many years, and I had all the symptoms. I had IBS-C, which is irritable bowel syndrome with constipation. With that, I had GERD, the gastroesophageal reflux symptoms. And then I also had abdominal pain, and my eyes were turning red. I had joint pain, which are all extraintestinal manifestations of this disease. And I was sort of written off by the pediatrician I used to see from time to time or urgent care centers saying, these are growing pains or you have allergies, this, that, or the other. I didn't get a diagnosis until I was 22 when I started having all of these things that I'm describing from childhood.
First, I just want to say I'm sorry for your loss. And I also want to say thank you for your willingness just to share that journey, which you had shared. It's traumatic. I have found, and this is my own personal experience, when you share something that's traumatic and personal to you, it's almost as if you are transplanted back to that time and that exact moment. So I just want to say thank you for your willingness to do that, because I know how hard that is to do, and I appreciate you just sharing that.
You're 100% right. A lot of times when we share some of these personal experiences with chronic illness, you end up like reliving that trauma. But like we do it because we want the greater good of society and destigmatizing these diseases. So that's why I do it.
I'm right there with you. I feel our stories, our personal stories of what we've lived through, allows people to see themselves or see somebody that they may know. And that creates this pipeline for more people to feel, to be informed, which leads to advocacy, which leads to more diagnosis and preventative care as well, in any space that could land in. So I love that. Next, you had mentioned earlier in the show about cultural stigma. Can you highlight just a couple more pieces or elements that you even see in the past that you see now as far as those stigmas that are associated with Crohn's disease?
Cultural stigma is a really interesting topic, and I don't think I had the vocabulary for it until I went through significant therapy. Dealing with a disease like this is not just embarrassing, it's traumatic. When you layer on pieces of your psychosocial experience that are culturally sort of embedded and internalized, it becomes an even more difficult journey and process to sort of bear. So, cultural stigma, in my experience, has been a few different things. Early on in my journey, within the first couple of years, I was told, Tina, change your diet, don't eat out so much, do naturopathy, or do Ayurveda, which is an ancient, like Indian form of medicine, quote unquote, do traditional Chinese medicine. So, there is this propensity towards complementary and alternative therapies in many Asian cultures. It's not always the case in every family, but this is something I'm hearing all the time, like day in and day out in my community, in the South Asian community, is that we have to try to do everything we can. This is digestive illness, so this must be something we did to ourselves. So that's all embedded into the cultural stigma. So is I have an ostomy. It's a bag into which I defecate because my rectum, my colon, and my terminal ileum have been removed via surgery due to extensive disease. That experience of having an ostomy has not just been life-saving, like it's allowed me to live my life again more fully and go back to school and do this kind of advocacy work. So that was a huge stigma in my community too, and still is. People will do anything to avoid an ostomy. It does not matter what they have to do, they will do anything. And the reason why is there is this sort of stigma that this is really, really foul. No one's going to want to marry you. Marriage is, as you may have seen, Indian weddings are a big deal. Our families really want us to get married and procreate. And then that's the other component. With bowel conditions, that's pretty close to some of your reproductive organs as well. With marriage, people start to wonder, is she fit to reproduce and to take care of her husband or her children? So my marriageability came into question. I was dating my husband back then, and I received a lot of remarks from family, extended family, in-laws, you name it, saying, he should not be marrying you. He got those comments too. So I would say those two things were some of the biggest stigmas I've dealt with. The propensity towards complementary and alternative medicine, and then the propensity to have this really stigmatized opinion of an ostomy.
First, this unsolicited advice that happens, and we value our culture, we value the things that could help from a natural perspective, but there is harm when it is moved in the direction that, oh, why don't you just try this naturopathic, why don't you just try this and that could cure? And I often tell myself, what makes you think first that I haven't tried all of those things? And Do you think that this is how I want to live my life and in a state of pain or different symptoms that are associated, and in my case with lupus, that feeling that I'm doing that to myself, this common thread, this common theme. And I think, and I know we need to be careful with our language, because even currently right now, there's this food is medicine, or we are doing this is because of our food product. Well, there are diseases that cannot be cured with what food you eat, or what you decide to use as far as a supplement or anything of that sort. And that message needs to be out there, because first, it's preventing people from coming in and finding out why they're having these symptoms or diagnoses. And that could be within a culture and even outside of, and that shame that comes with it, as if you haven't tried everything. My heart breaks for you, that history of what you had to go through and still go through, of you must be unfit. And there were a couple of other words, and we'll get to it, that I remember you shared during our panel. You are unworthy because you have a health condition, a disease process. It's unbelievable, but it is happening. And that's why this conversation is so important. Here's a reality check. According to the National Institute of Health, about 20% of the population navigates food sensitivities, whether it's allergies or intolerances. This becomes especially challenging when food is so tightly associated with the cultural identity and family traditions. Tina, from your experience, what advice would you give someone who's struggling to balance cultural food traditions with their dietary restrictions due to IBD or other chronic conditions?
Ooh, this is a great question, Dr. Bio. And especially when you're going to Nanti's house and they're offended because you're not going to eat their food. Honestly, I have done everything under the sun. And, whether that's going to their house, not eating their food, having eaten beforehand, bringing my own food, I would just say a lot of people, especially now, know I have this condition, and I am usually just upfront. Some people are very kind and they say, Tina, what can you eat? What can't you eat? How can I modify ingredients? Nowadays, people are definitely opening up to it. But in the event that I'm going to one of these events or just someone's house, I will just call them up and, or have my mom call them up, depending on the closeness of the relationship, and say, hey, do you mind if Tina brings her own food? And then they'll often be like, no. What can she have? Let me figure this out. And if I need to make this food a little less spicy, put a little less masala in it, as we call it, I'll do what it takes. Is she gluten-free? Is she dairy-free? What's the deal? I'm neither gluten-free or dairy-free. But spices can sometimes aggravate me, even though some spices work for me, some don't. So it's just one of those things where everybody's diet's a little bit different with IBD, and we all have different food sensitivities. And this isn't just with IBD, it's with a lot of different conditions. We all have different sensitivities, and that's perfectly okay. The thing that I want to highlight here is it's important to advocate for ourselves or have family advocate for us. Now, if it's a wedding, if it's an engagement party, if it's a Diwali party, I will often just say, I might just sneak in a little bit of my food or sneak out and eat my own food, that kind of thing. And they're planning a bigger event. I don't want to disrupt that process. And that's just me. I think it's up to everyone how they want to handle this situation. But I always say it's best to advocate for yourself.
I love your answer. That leading with the advocacy piece, because everybody will be in different situations. I call it this ebb and flow, that you're having to kind of, based on the situation, based on the people that are a part of that situation. Another piece of advice I share with advocacy: what is your goal? What is your intention? And I think if you lead with that when you're in a situation, if you're at a wedding, if you're at that, and you lead with that and you share that with whoever you are trying to converse with, like, this is the situation, it helps put everybody on an even playing field by first honoring yourself, like, this is my goal, this is my intention, and letting them know, I want to be here, I want to celebrate with you, but these are the things that I need to be able to support you in this amazing event or whatever you're doing. And I think that can be very helpful.
Absolutely.
So now I'm curious about self care and burnout. Many people with chronic illnesses feel exhausted trying to manage their condition while maintaining their daily responsibilities. For someone newly diagnosed with IBD who feels overwhelmed and doesn't know where to start, what would be your recommendation for a first step that they can take today?
When you're newly diagnosed, this is really, really overwhelming of a disease. It means that you have this for the rest of your life and you don't know what the rest of your life is going to look like. My number one thing would be take a deep breath. Take a step back and remember you are still a human being dealing with an illness like many human beings do. You mentioned 129 million people in the United States. I mean, that's almost half this country. So that deals with the chronic illness. Remember, you're not alone. And then once that first step is accomplished, then maybe you can start researching and looking into what your options are in terms of getting your quality of life back, starting to have questions with, starting to have conversations with your provider. But take that step back, take this in, what it means to have this disease. I'm saying that as a person who was 22 and ran from this disease and was in denial and was like, whatever, I have my life to live. But it's really important. Acceptance is a really beautiful thing, and it can lead to better outcomes, in my opinion, for patients.
Incredible advice, acceptance. Most of us, when there is something that we are in fear of, or we just don't want it to be possible, our inclination is to run and escape and get out of there.
Yeah.
And like, no, this is not happening. When you take that deep breath, like you mentioned, you can take in your situation, you can take in your environment, which helps you build the steps to how do you move forward? How do you live the best life possible with whatever situation? And that can be a very powerful tool minute by minute, day by day, because our world is changing incredibly fast. That is such great advice for the listeners. So I appreciate that. I heard you speak a little bit when we were at South by Southwest about how important your mom is to your own health team. Even as an adult, you ask her to be your ally at appointments. What else has been crucial to you as you navigate the healthcare system with complex health conditions?
It's my husband. He's been with me through thick and thin, really seen me at rock bottom when I was 85 pounds at the age of 24, dating, shitting my pants, pardon my language, using enemas, suppositories, and still saying, I love you and we're going to get through this. Not only did he stand by my side at that point, he stood by my side when family, extended family, friends said, why are you with her? You can do so much better. And not only did he stand by my side then, but through almost 24 surgeries, many doctor's appointments, and saying, you know what, Tina, people can say what they want. There's this phrase in Hindi and Urdu, log kya kahenge, which means, what are people going to think if you talk about this? He said to me, what are people going to think? Can go to hell. He's like, I'm here with you because I love you and I don't see a future with anyone else.
That gave me all the feels. When we look for our life partner, we look for someone that will truly be with us through thick and thin. Those words don't always carry what they should. For you to have found your person through thick and thin and know that it's you and him. My husband and I have a saying, it's the two of us against the world. You need that in this world. You need that person that really does have not only your back, your front, but all areas. And that's what you have. I appreciate you sharing that. So, this podcast is all about helping people understand their bodies and the healthcare system so they can be more informed and therefore advocate more for themselves. What have you learned about your body or the healthcare system that you wouldn't have known without your experience?
Power of positivity, the power of gratitude. I was just living life in the rat race. Get a stellar job after college. I worked on Wall Street. You get married, you have kids. I didn't know anything else. But chronic illness, invisible illness, really opened my eyes to there are really deep, painful aspects of life. And you can still build a fulfilling life out of those painful aspects of life. And I think for me, it was that experience that catapulted me into advocacy as well.
To wrap up our main conversation, if you could give listeners 3 key takeaways about advocating for themselves with a chronic illness, what would they be?
One, and I've mentioned this, is navigating the health insurance system. Learn it inside out. If you know it, you can advocate for yourself and you can advocate for any of your family members. That's one thing. Two, don't listen to what the world has to say. You are a human being of your own right, and you are still a human being in spite of a chronic illness or a medical device like an ostomy. Sometimes you're an even better human being because you've learned and grown through the shattering experience of chronic illness. And then three, always remember you too can live a fulfilling life if you want to. It's very easy for us to fall into the doldrums of the everyday life with an illness, but I think it's always important to find other things that define you, hobbies, skills that you have, because you are so much more than just your illness.
We need that reminder. We are more than our illness, our situation. We are human. We are made up of so many great elements and pieces that make us who we are. And this is a beautiful reminder. This conversation has been fantastic. Tina, you've shared so much wonderful wisdom today, and I know our listeners will walk away feeling more empowered to advocate for themselves in their healthcare journey. Thank you for sharing your expertise and your experience, not only as an advocate, but as someone living with many chronic health conditions. And for those of you inspired by Tina's journey and insights today, I highly recommend connecting with her online. I started following Tina on Instagram after I was on a panel with her at South by Southwest, and I hope you will follow her too. Her Instagram handle is at Own Your Own Crohn's. You can also check out her blog at ownyourcrohns.com. Both links will be in our show notes. Did something in this episode click for you? Share it with someone who might be struggling with chronic illness or symptoms they can't explain. Because here's the thing, real healthcare advocacy happens beyond clinical walls. It's about understanding our bodies, knowing our resources, and finding the courage to speak up even when it's difficult. You've got this.